The CDC and FDA last week recommended a temporary pause in the use of Johnson & Johnson's COVID-19 vaccine over blood clot concerns that are being seen in women. The vaccine suspension quickly prompted discussion online about how there's a much higher risk of getting blood clots from hormonal contraception. Here are the facts. 6 out of the nearly 7 million people who received the Johnson & Johnson vaccine reported a rare and severe type of blood clot. But when it comes to hormonal contraception, the National Blood Clot Alliance reports about 1 out of 300 women who are on the birth control pill are at risk for developing a blood clot. Dr. Monique Ruberu is a Catholic and naprotechnology trained pro-life OB-GYN who has stopped prescribing birth control. She joins us via Skype. Doctor, thank you for being with us. You have a powerful conversion story, and as I mentioned, you have stopped prescribing birth control. How did you come to that decision?
I was so blessed. My marriage was on the brink of divorce, and God stepped in and healed it. And as a result, I wanted to do something to serve him. So I went and I prayed outside of an abortion center. When I was there, I encountered somebody who gave me a book about naprotechnology. And all the time that I had studied for the OB-GYN specialty, I never knew that naprotechnology existed. And so when I read that book, I understood that there was an alternative that I could use instead of the use of contraceptive pills and hormonal contraceptives to address every GYN issue without covering it up like a Band-Aid.
The National Blood Clot Alliance reports 1 in 300 women taking birth control pills are at risk for blood clots. Those risks increase if you have a blood clotting disorder or a family history of blood clots. Doctor, what do women need to know about birth control pills and the risks for blood clots?
They need to know that birth control pills are never solving any issue. Even when they're using them in order to try and avoid pregnancy, they don't have a 100% efficacy rate. Instead, they could use natural family planning methods if they're in a marriage, and in doing so, they can avoid pregnancy by understanding their fertility. Oftentimes, people are taking birth control pills to address a GYN issue like abnormal bleeding or painful cycles. But even in that case, it's not really helping them. It's just acting as a Band-Aid to cover up the issues and the symptoms that they're having. But the minute that they stop those birth control pills, they're going to be dealing with the exact same issue, sometimes in a worse form. And so the recommendation is always to get off of the birth control pills, to understand what the underlying issues are, and to treat them naturally and effectively.
Besides blood clots, what other health risks are associated with hormonal contraception?
Birth control pills can actually cause you to have increased issues with depression and anxiety. It can cause you to have issues with weight gain. There are a lot of people that experience nausea and vomiting when they're doing birth control pills. You can have worsening PMS symptoms that can just tip you completely over the edge. And in addition to that, it can actually cause abortions in patients. They might not even realize it, but that thinning of the uterine lining makes it very difficult for a newly formed pregnancy to implant in that inner lining of the uterus.
Doctor, in hearing all of this, are we as a society just way too cavalier about women's health when it comes to doctors so widely prescribing birth control? It seems that women's well-being isn't really being considered here.
It's really sad because the majority of gynecologists and family medicine doctors, who are the ones who are prescribing these medications, don't understand that there are alternatives that are completely natural and completely in alignment with your natural body, the way that it works. And rather than shutting down the cycle, you can get to the root of all of these issues and have a wonderful understanding of your fertility at every moment of the month.
Dr. Ruberu, we are both Catholic. The Catholic Catechism is very clear that contraception is morally unacceptable. As a medical professional, as a wife and a mother, what freedom have you found in the Catholic Church's teachings when it comes to contraception and to being open to life?
It's such a beautiful thing to be able to unify with your spouse and to identify those times of fertility in your cycle. And at times, you realize that it might not be the correct time for you to try and conceive, but having that ability to decide when you're going to come together and when you're not going to come together, but at every moment being open to God's will, it's just such a blessing. You never feel like you're denying him, but you're actually just making choices based upon what you know to be true about your fertility. It's just such a freeing and beautiful thing. It helps to strengthen marriage, and it's wonderful.
That's so beautiful. We only have a minute left, but can you give a quick explainer as to what NAPRO technology is for viewers who may not know about that?
Absolutely. NAPRO technology stands for Natural Procreative Technology. It's the use of the Crichton Fertility Care Natural Family Planning method, where people will document their bleeding patterns, their mucus patterns, the length of their cycle. And in doing so, we're able to identify exactly when or if that person is ovulating. And that point of ovulation is used to do scientific testing, to check hormone levels, to understand more about thyroid function as well. And we can, just by looking at the bleeding patterns, we can oftentimes identify issues. Like if you have lower levels of progesterone, you might have tail end brown bleeding at the end of your period. Or if you have endometriosis, you'll have painful cycles and you might have premenstrual spotting. If you have polyps, you might have mid-cycle spotting. So just charting your bleeding patterns, your mucus patterns can tell you so much. It can be used to address every GYN issue as well as fertility issues.
Such an insightful conversation. Thank you so much for your work, Dr. Monique Ruberu. Thanks for being with us.
Thank you so much.